was a little bit beyond my wildest imagination. My colleagues and I, Philip Schnars in particular, who's my co-principal investigator, we've been talking about this since 2022. It just captured my imagination, this idea of the science of engagement and what does it mean to actually figure out what are the components that make engagement possible and have impact. And I always thought trustworthiness, trust and trustworthiness was an aspect of that. But typically, the research question is about, well, how do we get Black folks and other minorities and minoritized communities to want to get involved in research? What do we do to get them? And I want to reverse that question. I want to reverse the question and say, what do we as the organizations that do the research, in the Hastings Center, or any academic medical center or federally qualified health center that partners in research, how do we think about shaping their organizational trustworthiness?
So if I understand you correctly, you're interested in figuring out how to create trustworthiness where it hasn't been before.
Exactly. One of the key things when you work with a PCORI award, they're really committed to engagement with community partners as collaborators in the research, not as participants in the study. So that's a really big distinction. And that's why I'm really drawn to their work and the kinds of awards that they do. So I think what the difference is that we'll be working with collaborators who have been engaged with working with other scientists on research projects. I think it's important to differentiate between this idea of trust and trustworthiness. Like we're making a distinction, right? And the distinction that we're making is, you and I might trust each other. It goes this way. You and I have a certain kind of trust. But when we think about the trustworthiness of an organization, there is a kind of perception. The organization may or may not have failed me, it personally, but there is a kind of mistrust that I have collectively, right? Mm-hmm. This is a collective experience for people who are Black, people who are gay, people who are living with a particular disabled, exactly, have with this institution. They're known, or however we know it, to not be trustworthy when it comes down to X. I spent a lot of time in a clinical setting at a hospital, a very large hospital, doing clinical ethics, at the bedside, the dilemmas and the issues that come up between patients and families and clinical staff. And it was there that I was struck with, how do we change these things, these dilemmas that we're looking at?